Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Nicolas Fletcher. He's a health policy student, and he recently wrote the Kevin MD article, Strategies for Lifting COVID-19 Mitigation Restrictions. We're filming this in the last week of June, so his post is certainly very relevant. First off, Nicolas, welcome to the show.
Thank you, Kevin. It's a pleasure to be here. And like I said earlier, it's an honor, and I really look forward to our conversation.
All right. So before we get into your article, if you could share your story and your journey to where you are today with my audience, that'd be great.
Sure. I'm originally from South Jersey. I grew up in a regular middle class family. I went to college, undergrad at Howard University in Washington, D.C. Graduated in '01, and I worked for a number of years in the biotech sector, kind of following the human genome model after, we were able to map the genome. So a lot of biotech companies spun off of that. And I worked for 8 years as a research associate scientist doing drug development research for lupus, HIV vaccine research, and rheumatoid arthritis. From there, I kind of had, like most people, that, existential question of what am I supposed to do with my life around 27, 28. And I decided that was as good a time as any to, really go back and follow my dream was to go to medical school and get into medical school and become a physician. And so I went back to school. I, took the MCATs more than once, and I matriculated into Michigan State University College of Human Medicine, their post-bachelorette program. I did that for 2 years, and then I was fortunate enough to matriculate into the medical school and graduating in 2017. So,
Fantastic. So with the pandemic going on and you're a health policy student, this is right up your alley. So
yes.
we'll talk about your article, Strategies for Lifting COVID-19 Mitigation Restrictions.
Yep.
So why did you share the story behind that article?
Yeah, so for me, it was pretty much, part of it was born out of just, the being a health policy student at the moment, but then it also was my interpretation of answering questions that weren't being asked from our state, local, national leadership. I felt like people were very much focused on, COVID-19 then at the time was just still, testing was becoming an issue, but nobody was really addressing what do we do after the 6 months, the 4 weeks or the 6 weeks or 12 weeks. I felt like there was this humongous question of, okay, what is the next normal supposed to look like if we don't have treatment or don't have a vaccine? How are we as a collective supposed to be able to move forward confidently and continue, to do the things we need to do in order to outlast what is a global pandemic? And to me, I felt the need to answer that question, and then in answering that question, that's how the article came out.
So let's go into that article. So in an ideal world, what is your strategy for lifting those mitigation restrictions?
For me, I think it's very, very important that people have access to knowledge. And you also need to, in that, knowing where to get tested when they need to be tested, knowing that their hospital systems are able to handle the capacity. Because I think a lot of people forget that it's not just COVID-19 patients that are in hospitals. Most hospitals are already at 50, 60% capacity on any given day. And when you add a surge of patients as complicated as COVID-19 patients, you're now not only seeing those days, not only seeing those beds occupied, those beds are also being occupied for much longer than your average patient. And so that puts a strain on the health system in your local community. And if they're not ready to handle that type of patient population, then that means those who are in need of, a femur fracture, or those who just have, a childhood upper respiratory infection or anything else that impacts them. And without people absolutely understanding that just because they don't have COVID-19 doesn't mean that they're not going to be impacted in their community. And so, again, knowing where to go to get tested, knowing your hospital system can handle it, and also getting the information that you need in a timely manner from the people that, are in the know, such as your local healthcare provider, your local county healthcare providers, the government, local government, mayor, all the way up and down the chain. And so getting that information in a timely manner and knowing where to get tested and knowing your hospital system can handle it, I think, are some of the most important things. And it sounds really basic, but at the same time, don't have to listen to the news or anything or read anything long enough to realize that those things aren't in place.
Yeah, why don't we go into more analysis on that? Because you wrote this strategy back in the end of April. We are now talking in the last week of June. Can you give your analysis on the current situation as it relates to the pandemic?
Yeah. So, my article is written pretty much looking past that first wave of the pandemic. The notion that, okay, there might be, you're going to see this, this very steep increase in number of cases, number of hospitalizations, but then you're going to see it, eventually come down. And the flattening of the curve, as people were trying to get to, is more based on the social distancing that needed to be in place. And as long as people were respecting that social distancing, the mask wearing, and things of that nature, that is what leads to decrease in those numbers. But unfortunately, I don't personally believe we're even past that first wave, that first surge, because we're not even into fall, we're not even into the flu season. And so we're still in that first wave, whereas, places like New York and New Jersey and Michigan, where I am, we saw that wave come through earlier. But now that we're looking at Texas and Florida and Phoenix, Arizona and California, again, people are beginning to understand that the kinetics of the virus is going to be what it is. It is the only control. It is the only standard that we have, in that it's going to do what it wants to do when it wants to do it. We're the ones that have to change our behavior. The virus is just going to do what it's meant to be, what it's meant to do, which is move from one host to the next as much as it can, as quickly as it can.
Like you said, there are outbreaks right now in Texas and Arizona and in Florida and now even in California. And what needs to happen next? I just heard that the governor of Texas, they're closing bars.
Mhm.
They're talking about shutting down elective surgeries again. It
Yep.
sounds like we're going back to where we were in March and April.
Yep.
So if you were in charge of public health policy in this country,
Mhm.
what would be your suggestions going forward?
Testing is absolutely needed. We need to be able to test anywhere from about 6 to 8% of the population locally every day. And without being able to do that, we have no idea where the virus is in the community. We have no idea how prevalent the virus is in the community. And so long as we don't have that information, we're always playing whack-a-mole. We're always trying to catch up to where the virus is. We're not being, proactive. We're being reactive as a community, and that's going to be the normal, the next normal, until we find a vaccine, or until we develop a vaccine, or really good therapeutics that come close to a vaccine. But until then, if we don't put these mitigation factors in place that I've talked about, the testing, the hospital systems, even the antibody testing, finding out if people have it, and if they don't have it, knowing that they can possibly go back to work, or be more responsible about their movements, without having those basic things in place, because we have no other we have nothing else in our arsenal for COVID-19. And the only thing that we can do is change our behavior so that we lower the risk from ourselves to others and those around us. And unless people are willing to think about others, I saw a blurb where it showed that the risk of COVID-19 was low, but those who were feared contracting COVID-19 was very high in early May or early March. It's now switched. The risk for COVID-19 is actually increased dramatically, and people are no longer concerned about them or their fellow man and risk of infection. And so that has to go back to where it was in March, now that the risk of infection is high, and now people need to be more aware of their risk of infection.
So I want to be realistic because there is a possibility that we'll never get to where we want to be when it comes to testing.
Hmm.
Everything that we're using to combat COVID has been politicized. Even wearing a
Right,
mask, of course, has been politicized.
right.
So, assuming that we're going on our current trajectory and we don't have the testing that we need, what's going to happen in the next 3 to 6 months as it relates to the virus?
Again, the virus. I believe the virus is going to do whatever it can to survive. That's what viruses do. They just move from host to host, and so we're going to see people continually getting infected. I think we're going to end up with a leveling of the plateau of infections. We just saw our highest number of infections. I think 33,000 in a day yesterday or day before. That number is going to either plateau between now and the fall, and then I believe it's going to increase when we start seeing flu cases come around, and more people are going to be trapped indoors again after having been moving around all summer. And then we're going to be right back where we were in early March if people do not take this seriously through the summer.
And what's your opinion about schools opening or not in the fall?
Interesting question. My wife is a psychology professor at K College here in Michigan, and they are grappling with this very question about what is school supposed to look like in the fall. Again, I'm a student. Fortunately, I'm distance learning, so nothing has really changed for me. The program was pretty much built for this, but I think for especially for college students, it's going to be incredibly difficult to put them on campus and expect them to social distance the way that they need to. And so my fear is that unless these institutions have very strong leadership and make it clear to students that okay, we are sort of in the same way that governors are saying, look, we're doing the best we can with what we have, and we need you guys to play your part. We need you to lean into this and say, we're going to maintain all the social distancing we can. We're going to do our best to, not socialize to an extent that's going to lead to some type of super, infections, event. I think you're going to see a hybrid model of institutions. Going to, some are looking at decreasing class size. Some are looking at going totally online. If I had to say one thing over the next, I would lean towards trying their best to do some type of distance learning, at least for the fall semester. I know that's not what people pay for college. That's not what you want your college to be. But I feel like putting everybody in a dorm, for 4 months and then expecting them to social distance is going to be very difficult. And so I would lean towards more distance learning. I would lead to smaller class sizes. I would lean towards anything that can essentially remove the barriers for students being able to do what they need to do to stay safe.
We're talking to Nicolas Fletcher. He's a health policy student, and he wrote the Kevin MD article, Strategies for Lifting COVID-19 Mitigation Restrictions. He's given us a wonderful insights on the pandemic and perhaps our next 3 to 6 months with the pandemic. Nicolas, what's your take-home message for the Kevin MD audience?
I would say it's important, especially for a Kevin MD audience, that right now physicians, we really need to be front and center of not just dealing with our COVID patients specifically, but I think it's important that we step forward and speak up for public health and speak up for the importance of public health. I think it has become the scapegoat for the last couple of weeks because of what has become a more of a political argument. And I think physicians are strategically placed in the intersection of politics and healthcare delivery and just interacting with patients that we need to be able to stand up and say, okay, this is what we believe our patients and just the general public should be doing to take care of our health moving forward during this pandemic.
Well, thank you so much for sharing your expertise, and thank you for being on the show.
It was my pleasure. Thank you, Kevin.